Good afternoon and welcome to Jana Hughes, legislative candidate from District 24. Thank you, Jana, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland, and joining me today are AARP lead advocacy volunteers Joyce Beck, Janet Davis, and Mike Barwig. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. Jana, we appreciate your taking the next 30 minutes of your time to meet and discuss issues of importance to the 50-plus voter and their families in your district and across Nebraska. As a short background, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering and strengthening people 50 and older to choose how they live as they age. As people live longer, healthier lives, we know we need to think differently about what it means to age. So with that, Jana, if you want to start us off by giving us a little background about yourself and your campaign, and usually around 5 minutes or less on that would be great. And then once we've completed your opening, we'll move into the questions. So welcome, Jana.
Yeah, thanks. Okay, so I'm Jana Hughes. I grew up on a farm near Goner, Nebraska, which is in our district. Our district is Seward County, York County, Polk County, and a little bit of Butler. Graduated Seward High and then left the state, got an engineering degree down in Texas at Texas A&M University. And I worked for an engineering consulting firm for about 7 or 8 years total. During that time, I ended up marrying my husband, Jana Hughes, who was from here, and his family business is Hughes Brothers Manufacturing. And they've just celebrated 101 years in business. Wow. So yeah, quite some good longevity there. And then back to my farm, my brother is 4th generation farmer of Luby Farm. So we've had a long time in this area, and hopefully generations to come to still live here. And so that's a little bit why I'm into this whole thing. When John and I got married, we lived in Nebraska, and I flew out for the consulting job. And then when our oldest was born, I took the best job ever, became a stay-at-home mom. And I've got 3 children, 2 girls and a boy. My oldest just started her real job. She's a nurse down in Kansas City. And I've got a daughter in college right now. And then my son is a junior in high school. Throughout that time with the kids, volunteered a lot. My kids went K through 8 to a Lutheran school and then Seward Public High School for high school, and ultimately landed on school board, Seward Public School Board. And that is what got me into this realm. Our superintendent suggested when Mark Coulterman was retiring that I should consider running. I've got the ag background with my engineering degree. I've been on school board. And I, understand the economic development of a business, how that affects our state and district. So there you go. That's why I threw my name in the hat. Kind of the 2 issues I hear about in our area the most are our property taxes, which is really a school funding issue. And then another thing that I'm really interested in is rural broadband access. I think our towns are getting pretty good, but we have some holes out there, and it's critical. It's essentially a utility now, and so it's very vital that we get that going. And there's been a lot of money thrown at it, and some places have done a much better job than others. So anyway, those are kind of my 2 things. The other side to it, I say my strategy is developing relationships within our district, with all just different people within the district. So when legislation passes my desk, let's say it's about something that deals with retired people or aging, I have those connections made with people in my district that I can go to and say, okay, how does this affect you? Because I know the lobbyists will be telling me a lot of information, but I want to know how that affects District 24. And then the reverse side of it is I've got to develop those relationships with the other 48 senators, because 1 of 49 isn't going to get me very far. So I guess that's it in a nutshell. Yeah, so I'm excited. Some days I'm more excited than others. Sometimes I'm really nervous and I'm thinking, what am I doing? So
I think, Jana, that might be just life in general, right?
Yeah, right. Exactly.
Yeah. Well, I appreciate your sharing that. Thank you for sharing about your family, your background. I do think we have some commonalities that we'll kind of get in here with some of our issues and crossing over on that. So we have provided you with a set of 3 issues containing 4 questions pertaining to the 50 plus in Nebraska. And we are, again, because of our time constraints, allotting about 5 minutes for each of those questions. So our
Okay.
first question is on health, caregiving, and home and community-based services. And Michael Barwig, our volunteer, is going to take that. So go ahead, Mike.
Good afternoon. How are you?
Good. Hi, Michael.
Hi. So home and community-based services, also known as HCBS, provides an array of services designed to help assist individuals with activities of daily living that promotes independence to support them to age in place or later delay institutional care. A family caregiver is any family member, friend, or acquaintance who cares for another person that is unable to live independently. And these people do this often without pay. Telehealth services can be significant for older adults in rural areas and underserved communities, while also providing support to family caregivers by reducing travel time, wait times, and costs associated with in-person care. So we have two questions under this title, and the first one is, what will you do to support the 240,000 unpaid family caregivers in Nebraska through such policies as enhanced respite services, access to telehealth, caregiver education and training, and help with out-of-pocket costs? And the second part of the question is, what will you do to protect and or expand the home and community-based services, HCBS program, particularly recruitment and retention of a sufficient workforce and adequate funding of the services that Nebraskans and their families now rely on?
So it's interesting timing wise that we're having this interview. About 2 weeks ago, I actually, within our district, York General Hospital supplies, they have a group that does in-home healthcare in, just around the communities of York and within York. And I actually was fortunate enough to get a go visit there. And then we went ahead and did an on-site visit. It was a preliminary visit, just outlining like what the individuals would need, what kind of services would come in, the timing and all of that. And first of all, let me back up and say, I think the longer time you can stay at home, the better, of course, before going to a nursing facility or, having to go to the hospital or whatever. So whatever we can do to enhance that, I think you just have a better quality of life. Clearly the individual wants that. It's just better for our systems. I mean, we have counties in Nebraska that they're losing nursing. We don't even have nursing facilities in several counties here. And so it's becoming an issue. So I think the more things we can do to help people stay at home, the better. But with this visit, interestingly enough, so we went on the visit and I actually randomly knew the people and, they'd asked permission that I come. Well, I just stopped there. It was seriously 2 days ago. Just to check in, and the guy that had asked for services with his wife wanted a sign. So I stopped in and got to just check in with them. And they just said, it has been a blessing. I mean, it's been going on for now just a couple of weeks, but a blessing for him and his wife. And so I think that's just a testament to what those are. So what will I do to help? I mean, I'm an advocate. I think we need to do as much as we can. This question, I think, ties into one of my two areas, which is that rural broadband access. We have got to have good broadband so that you can do those telehealth services. Training can be done on that for the caregivers, and it has to be affordable, accessible, and good quality. So I think that would help. As far as recruitment and retention of a workforce, that's not a problem anywhere, is it? I am on school board and we are lacking in paras. We've had a custodial position open for 6 months. I think we don't even get an application. Nebraska's at what, 1.9%, 8% unemployment. This is an issue across all workforce, not just a specific. It's a very big problem. And from reading the information you sent, I didn't even, what was it? By 2034, people age 65 and over are going to outnumber those under 18. We're shifting into older population. And as you age, you typically retire, right? So that's even more workforce leaving us with a gap. And I don't have a great answer. I mean, if I did, geesh, I could solve all the state's problems, I think, and the nation for that matter. I think Nebraska has to do what it can to keep the people that we do have here and try to attract more. And part of that is clearly having good internet access everywhere, especially to our rural areas, because guess what? I don't have to live in Omaha. I don't have to live in Lincoln. I can move to the smaller communities, but I have to have the access to broadband. And we can attract more people here. So like I said, I don't have all the answers to that, but we've got to make Nebraska attractive place that we have, we can get people coming in instead of leaving, hopefully. So.
Very good. Thank you.
You're welcome.
Thank you, Jana. Our second question kind of veers more now into facility type of life for those that are older. And again, nursing facility quality is what that topic is. And Joyce Beck is going to take that. So go ahead, Joyce.
Okay, Jana, thank you again for your time. We really appreciate you taking the time to answer these questions. Over 20,000 Nebraskans require care in nursing facilities or assisted living communities. As you mentioned, facilities have closed their doors, and they cite reimbursement challenges and staffing shortages as some of the reason. Nebraska will need an additional 4,700 more nursing assistants, LPNs, and RNs by 2028 to meet Nebraska's care needs. Everyone, regardless of where they reside, deserves to be treated with dignity and respect and to have access to quality medical care. Better staff to resident ratios improve the overall quality of care and the well-being of residents. Workforce recruitment, retention, and job satisfaction challenges are prevalent across the long-term care services and the support industry. Causes of workforce challenges must be identified and implemented to respond to the growing need for high-quality care. So, Jana, here's my question for you. What will you do to improve the quality of nursing facility care for Nebraska residents, including addressing the growing long-term care workforce crisis in the state, professional education and training, and accountable facility reimbursement?
So I'm going to back up and just say one thing. So my oldest daughter, I said, is a nurse now down in, she just graduated May with her RN. She was a CNA, got that at high school here in Seward, and worked at our nursing facility here in town for many of the kids do here, right? They get their CNA in high school and then they have a job right away, and it's a good job. And, we've been experiencing the shortage. She was supposed to have, there's supposed to be 2 CNAs on each floor when she worked her shift, in the evenings. And of course, a lot of times you go and it'd just be her. And she just felt scrambled, just felt like she couldn't give the proper care, right, to each resident, getting them ready for bed or, whatever that all took. So this is a problem that's been going on for a long time. I think one thing that directly the legislators can help with is that reimbursement rate. That's what I've heard from a lot of people, that these facilities are getting reimbursed even at a lower rate than what the actual cost is. And so so that is a huge issue, and probably directly related to these nursing homes leaving some of the different counties. I think that it's hitting more rural areas than the urban areas. So, I think that's something that can be addressed legislatively wise. Again, that workforce shortage it's a problem. We don't have enough teachers coming in, even getting teaching degrees to teach our kids. That's a problem. We don't have Hughes brothers, where my husband works, will put out a notice that they need people, and they don't have enough welders or whatever. So I want to, if I could have a little machine that produce robots or something that could do these jobs, that would be a good answer, huh? I think, and I don't know if this is a state issue or more of a federal one. I mean, can we investigate work visas to get, people in too, to help with some of these things from, we've got a problem at our border, but if they're willing to work, maybe that can help address. And again, I think that's a little bit higher up than me, but I think those are things that need to be looked at. So support, yeah, I realize the problem, and I wish I did have a good answer. I'm sure you guys do too, so.
Well, thank you, Jana. I appreciate your time and your answer.
Thank you, Jana. And I do want to thank you for sharing your daughter's experience. And truly, that's where AARP is the patient advocate. And so a lot of times that's what's missed is that patient to staff ratio, that quality of care. There's that barrier when you don't have enough staff, then obviously the resident's the one that tends to.
Directly. And honestly, it makes the staff suffer, because she would come home just so frustrated or almost just feeling bad because she felt like she didn't give everybody what they needed. And that's why you go into that profession, right? You're a caregiver. And yeah, it's just that's hard. It's hard.
Yeah, so I do. Thank you. I appreciate you bringing that to light. Our final question then for discussion today centers around livable communities and helping people stay in their home. And Janet Davis is going to take that. So go ahead, Janet.
Thank you for joining us today, Jana. We really appreciate it.
And I just got to say one thing. We're all like Jay. We got Joyce, Janet, Gina, Jana. Okay, carry on.
I'm the oddball.
You're the oddball out, so you know.
I noticed that too. I was having to listen really carefully when
I
know. Talking. Thanks for joining us again. My family lived in Osceola for 12 years. So I'm familiar with that area. Yeah. And the people there, another important aspect of living a fulfilled life is to reside in what AARP refers to as a livable community. Several aspects are included in this. And livable community needs to be safe and secure. It offers affordable housing and transportation options that allow individuals to travel by multiple means, and it provides supportive community features and services for people of all ages, allowing people to remain in their communities as they age. Also needed is affordable and reliable health care, and transit options are critical to support older Nebraskans aging in place. As we mentioned before, high-speed internet should be affordable, reliable, and accessible for all Nebraskans. Digital skills development is also essential to obtaining the benefits of high-speed internet access in the home. Having the internet doesn't do us any good if we don't know how to use it. So our question for you today is, what will you do to ensure all Nebraskans, mainly those 50 plus, have access to livable communities which offer affordable housing, diverse transportation options, adequate health care, and affordable, reliable, and accessible high-speed internet, including digital skills development?
Okay, so I'm gonna mention two things. So one thing also that I also got to tour York General, and I know Seward Hospital as well does that. And those are our two bigger communities in our district. They have a lot of services offered where specialists, they call the specialty clinic, will come out to these areas, and maybe the orthopedic guy is there one day a week, or just the specialty services. And I think that is such a benefit for our communities, because you're closer, you don't have to drive to the Lincoln or the Omaha to get those services. So I think the more we can encourage that at our smaller hospitals, the better. So that's a good thing. The other thing, and I've really seen this a lot now because I am going door to door in a lot of these communities, is I always call it the creative housing that's been going on. And I don't know if that's, I don't know if there can be partnerships, like public-private partnerships that encourage some of this, but like, for example, in Milford, I believe it was a nursing facility that closed down, but then someone is coming in and making those into apartments for, you know, and I'm not even going to pretend, I don't know what the criteria are to get in there. I don't know if it's age or income or what, but I think encouraging those kind of opportunities for these communities to have those living situations that are, like you're saying, safe. Just last night, I was knocking on doors on this little circle that I didn't even know existed in Seward. And it was duplexes, and a gal I knew invited me, and she's like, "You got to see this. It's great. It's all one level. It's 2-bedroom, the wider doors." I mean, it was made for older people. And there was probably about 20 units, 10 different standalone duplexes. So I think the more things we can do like that encourage, whether it be a public-private partnership in these communities, to have that housing to keep, you know, people together, and they're safe and safe just in terms of from, you know, falling and all that. And then of course the internet, I'm really would like to delve into. I know there's many layers that involves, it all is about who your telecommunications person is in your region. For example, in our region, Henderson area has buried fiber to every rural resident. How did that happen? And they have, I know, thank you, right? And they've had for years. And I was at the Polk County Rural Public Power meeting, and they're talking about doing a partnership maybe with their telecommunications, because we have rural power everywhere. You know, can we encourage cooperation there? So I think there's options to do partnerships with different groups to help provide some of these services that and you know, let's be honest, it's not just for, at least the internet, it's not just for the elderly, that's for everyone. And we really need to encourage that to happen. The digital skills development, I probably don't know. I haven't really honestly even thought about that. I know the library systems and things like that offer programming, and you know, if we can encourage even more of that. And again, and that's a city or county run thing to get that training. Because like you said, you can have the internet, but if you don't know how to use it, that doesn't do much good. So you know, it takes a village, right? It takes a community. And that's the one thing I found out seriously is Nebraska is a huge community. If I knock on any door, I can guarantee in a couple sentences, we can have some connection with something. And that's pretty special. And that's what makes, I think, Nebraska unique. And we do, and we're a state that cares for each other. And so, and we really do. We know our neighbors, we care about our neighbors. And so that means we'll work together to figure it out. So we do have some issues ahead, but we have good people to deal with them. So I think we can get there.
Earlier when you mentioned you'd like to build connections, that's what AARP is all about. We appreciate the connections we can make, and connections with our legislators are extremely important to us.
Well, and I want to be available, right? And I've really said that too. I want to be, you know, whether it be a phone call or an email or whatever, accessible, available, because it's people have that information. I'm just going to try to bring it to, you know, what we need, you know, in Lincoln to make those decisions happen. So
thank you.
Yeah,
Thank
sure.
you.
Thank you, Jana. As we now come to the end of our meeting time, I'd like to offer the final minutes to you for any closing thoughts or comments that you might have for our members and of course the constituents of your district. So I will hand you back about 3 or 4 minutes before we're ready to close out. So go ahead.
Usually I get told I talk too much. And so, so they're like, okay, like you've got about a second. Anyway, well, one, thanks for having me, and good to meet all the J's. And but Gina, is it a J or a G? It might be a G. Anyway,
it's a J.
Just sound. Anyway, thanks for having me. I appreciate the opportunity for this interview. What do I want to say? I think, like Nebraska has issues. They're not just our issues. I think our whole state is facing a lot of different issues. I think COVID, the pandemic, accelerated some of the issues that we're seeing. I fully believe a lot of semi-retired people fully retired during that time. again, I have my school board hat on, but you know, we're missing bus drivers and lunch help. And a lot of those were kind of that semi-retired age, which would be the AARP. I hear I'm in the AARP. Hey, okay. Anyway, so I think that escalated some of that, and we've got to be creative in finding solutions going forward. And honestly, our state, we got to stop any barriers that we're creating, whether it be legislation or what, to making those things happen. So if there are barriers in place, let's knock them down so that we can come up with good solutions to, you know, for our elderly, just all our population, that we can and get workers here. And I know some of the issues too are even certificates or whatever, like coming in from a different state. I'm not even gonna pretend to know the healthcare side, but I know if my daughter's a nurse, she's in a consortium with like 28 different states that she can be a nurse in those 28, but I'm still questioning, why can't she go to any state in the United States and be a nurse if she has a nursing degree? So again, barriers. So look, you know, taking down those barriers and doing what we can. And Nebraska is a pretty special place to be in. I'm really thankful I raised my family here. I'm really thankful I live here. And my intent is to keep it that special place and just make it better. So I think that's it.
Perfect. Thank you again, Jana, for taking the time to visit with us. We wish you the best with your campaign, and thank you most importantly for meeting with AARP. Take care.
Absolutely. You guys too. Have a great day.
Bye-bye.
Thank you.
Thank you.